25 years ago, a generation removed from the horrors of widespread infectious disease, America celebrated the elimination of measles, a monumental achievement that seemed to relegate the disease to the history books. It was a disease that once struck millions annually, leaving a trail of severe illness, debilitating complications, and tragically death, especially among the most vulnerable. This hard-won victory was the result of decades of painstaking scientific progress, relentless research, and the unwavering dedication of countless medical professionals. Central to this triumph was the widespread acceptance of, and public trust in, the MMR vaccine, a safe and effective tool that offered protection against measles, mumps, and rubella. Measles became a distant memory, a fading photograph in the album of public health concerns, a testament to what coordinated public health efforts, driven by science and fueled by community participation, could achieve when working in unison. But today, here we stand in 2025, a mere quarter-century later, and that hard-won progress, that sense of security, is tragically unraveling before our very eyes. Measles is back with a vengeance, and we're facing the largest outbreak in a generation, a stark and alarming resurgence that threatens to undo decades of progress. This isn't a natural disaster, it's a crisis that was entirely preventable, a self-inflicted wound on our public health infrastructure. The vaccine itself hasn't failed. It remains as safe and effective as ever. Instead, our collective willingness to use it, to embrace the science and protect our communities has faltered, leaving us vulnerable. Case numbers are climbing at an alarming rate, surging to levels not seen since 1992, before the widespread elimination efforts took hold. This resurgence is shattering our sense of security, eroding the confidence we once had in our ability to control infectious diseases. For many, particularly younger generations, measles was just a story from the past, a historical footnote in medical textbooks. Now it's a present and palpable danger, a threat lurking in our communities and schools. Emergency rooms are once again seeing a surge of children presenting with high fevers, a telltale sign of infection, persistent coughs that rack their small bodies, and the unmistakable spreading rash that confirms the diagnosis. Measles is not a mild childhood illness to be taken lightly. It's a serious and potentially devastating disease. It can cause severe complications such as pneumonia, a dangerous lung infection, encephalitis, a potentially fatal swelling of the brain, and lifelong disabilities that forever alter the course of a child's life. This resurgence is a stark and urgent reminder that public health victories are not permanent. They require constant vigilance, sustained investment, and a commitment to evidence-based practices. The very tool that once protected us so effectively, the MMR vaccine, a marvel of modern medicine, is now being tragically neglected in far too many communities, leaving vulnerable populations exposed and at risk. To reclaim our safety, to restore our collective immunity, we must understand how we got here, what factors contributed to this decline in vaccination rates, and more importantly, what it will take to turn the tide, to rebuild trust in vaccines, and to ensure that every child has access to the protection they deserve. The numbers tell a sobering story, a narrative woven with statistics and trends that paint a concerning picture of our current health landscape. We're not just looking at abstract figures. These numbers represent real people, real lives, and a very real threat to public health. Over 1,270 measles cases have been confirmed this year, a stark reminder of the disease's resurgence. Each case represents not only individual suffering, but also a potential source of further spread within our communities. The highest since 1992. This peak underscores a significant setback in our public health efforts, reversing decades of progress in controlling and eliminating this highly contagious disease. This isn't a small outbreak. It's not confined to a single region or community. It's a nationwide crisis, straining our healthcare system, stretching resources thin, and placing immense pressure on our dedicated healthcare professionals. The impact is felt across the country, from bustling urban centers to smaller rural communities. The vast majority, 95% of those infected, were unvaccinated, highlighting the critical role of vaccination in preventing the spread of measles. This statistic underscores the vulnerability of unvaccinated individuals and the importance of achieving high vaccination coverage rates. Each new case is a link in a chain that could have been broken by vaccination, preventing further transmission and protecting vulnerable populations. Vaccination acts as a shield, safeguarding not only the individual but also the community as a whole. 3 preventable deaths have already occurred, all among the unvaccinated, a tragic reminder of the potential severity of measles and the devastating consequences of vaccine hesitancy. These deaths serve as a somber call to action, urging us to prioritize vaccination and protect lives. Measles is not a harmless childhood illness. It can be deadly, leading to severe complications such as pneumonia, encephalitis, and even death. The misconception that measles is a benign disease must be dispelled to encourage informed decision-making regarding vaccination. The surge in cases and preventable deaths is a direct result of declining vaccination rates, fueled by misinformation and vaccine hesitancy. Addressing these concerns and promoting accurate information about vaccine safety and efficacy is crucial to reversing this trend. We're seeing the consequences of letting our guard down, of complacency in the face of a preventable disease. The impact extends beyond individual health, affecting our communities, our healthcare systems, and our overall public health infrastructure. The solution isn't a mystery. Higher vaccination rates protect everyone, creating a shield of community immunity that safeguards even those who cannot be vaccinated. Vaccination is a collective responsibility, a shared commitment to protecting the health of our communities. If this trend continues, we risk losing our measles elimination status, a hard-earned achievement that reflects decades of dedicated public health efforts. A blow to our nation's health, undermining our progress in disease prevention and control, and potentially leading to further outbreaks of other vaccine-preventable illnesses. The data is clear. Our fight against measles is far from over. We must redouble our efforts to promote vaccination, combat misinformation, and protect our communities from this preventable disease. The time to act is now, before the situation worsens and more lives are at risk. For measles, the magic number is 95%. That's the vaccination rate needed for community immunity. Measles is so contagious that one infected person can spread it to 90% of nearby unvaccinated people. When vaccination rates dip below 95%, outbreaks become inevitable. A single imported case can ignite a chain reaction in under-vaccinated communities. That's exactly what's happening now. Outbreaks are concentrated where MMR coverage is low. Schools with clusters of unvaccinated children become high-risk zones. It only takes one case to force closures and sicken dozens. The science is clear: high vaccination rates protect communities. Low rates invite disaster. Our current crisis is the direct result of too many communities falling below this critical threshold. The lesson is simple: measles returns when we let our guard down. Herd immunity, sometimes called community immunity, is like an invisible shield. It's a concept that illustrates how interconnected we are when it comes to health. This shield protects everyone, but it's especially crucial for those who can't be vaccinated due to medical reasons or age. They rely on the immunity of others to stay safe. Newborns, whose immune systems are still developing, and people with weakened immune systems, such as those undergoing cancer treatment or living with autoimmune diseases, rely on the immunity of those around them to keep them safe from preventable diseases. It's a shared responsibility. When enough people are vaccinated, we create a buffer. The virus hits dead ends, unable to find enough susceptible hosts to continue spreading. As a result, outbreaks fizzle out, protecting the entire community. But as vaccination rates fall, that shield weakens, leaving us vulnerable to outbreaks of diseases we thought were a thing of the past. This weakening leaves the most vulnerable exposed to serious and potentially life-threatening illnesses. Each unvaccinated person creates a gap in that protective barrier, weakening our collective defense against preventable diseases. For some, even a simple trip to the store or a routine doctor's office visit can become life-threatening if exposed to measles or other vaccine-preventable illnesses. Losing herd immunity means failing our social contract, the unspoken agreement to protect one another, especially those who are most at risk. Public health depends on shared responsibility. It's a collective effort that benefits everyone. Therefore, getting vaccinated isn't just a personal choice. It's a communal act of protecting those around you. The resurgence of measles and other preventable diseases clearly shows what happens when this principle of shared responsibility is abandoned. Rebuilding herd immunity is not just a medical goal focused on statistics and infection rates. It's a moral imperative, a call to action to protect the vulnerable and uphold our commitment to one another. Vaccine hesitancy is driving the decline in immunization rates. Non-medical exemptions for school vaccines have doubled in some states, creating clusters of unvaccinated children. Misinformation online and eroding trust in institutions fuel this trend. The success of vaccines has ironically made some parents more afraid of the shot than the disease. Reversing this trend requires rebuilding trust and countering misinformation with empathy and facts. The myth that the MMR vaccine causes autism began with a fraudulent 1998 study, now thoroughly debunked. Dozens of large studies have found no link between vaccines and autism. None. Yet fear persists, fueled by misinformation and emotional stories online. The signs of autism often appear around the same age as the MMR shot, leading to mistaken assumptions. Correlation is not causation. The science is clear. Vaccines do not cause autism. Allowing this myth to spread has real consequences, as seen in today's outbreaks. We must confront misinformation head-on to protect children from real, preventable dangers. Public health experts are sounding the alarm. Measles is so contagious it can linger in the air for hours, making outbreaks hard to contain. Pediatricians describe the heartbreak of treating children for a disease that should be history. States with lax exemption laws are seeing the worst outbreaks. Experts like Dr. Paul Offit argue that personal belief exemptions threaten public health. Stronger immunization laws, public awareness campaigns, and support for healthcare providers are urgently needed. The consensus is clear. This crisis is self-inflicted and preventable. The vaccine works. The problem is not enough people are getting it. Public health leaders urge immediate action to restore high vaccination rates. We have the tools to stop this, if we choose to use them. The COVID-19 pandemic disrupted routine childhood vaccinations. Millions of children missed their shots as families postponed doctor visits. This created a dangerous immunity gap, leaving more kids vulnerable to measles. The pandemic also fueled broader vaccine distrust, making it harder to promote even long-established vaccines like MMR. As we recover, catching up on missed immunizations is critical. Public health agencies are urging parents to check records and schedule appointments. Rebuilding trust and closing the immunity gap will take time and resources. Today's measles outbreaks are a direct consequence of these disruptions. The measles resurgence is a crisis we can solve if we act now. Every eligible child should be up to date on their MMR vaccine. Healthcare providers must reach out to families and address concerns with empathy and facts. Stronger school immunization requirements are needed to protect all children. This isn't about infringing on liberty. It's about protecting our communities. Reclaiming victory over measles means restoring trust in vaccines and learning from the past. We have the knowledge and tools to end this outbreak. Let's work together to ensure measles